You know that feeling, that little knot of stress that can tighten up just thinking about a hospital outpatient visit.
Oh, absolutely. The long waits, maybe feeling a bit lost.
Exactly. It's pretty common. But what if it didn't have to be like that? What if your next OPD visit felt, well, smoother, more like a positive step?
That's really what we want to explore today. Because we get it. Navigating those outpatient departments, especially in busy hospitals, can feel, well, overwhelming.
Right. So think of this deep dive as your personal guide, your strategy session for making those OPD visits less stressful.
Hmm.
We've looked at quite a range of stuff guidelines from accreditation bodies, JCI and India's
A
NABH.
Joint Commission International and the National Accreditation Board for hospitals and healthcare providers. Yeah, important standards there.
And also practical tips from healthcare consultancies like Supremedic, plus, advice aimed directly at patients.
Our goal here is really to pull out the most useful, actionable advice from all that.
Yeah, to help you turn those potentially stressful visits into something where you feel more clued in, more in control.
And ultimately able to focus on your health, which is the whole point, right?
Definitely. Okay, so let's start with the basics. OPD outpatient department. What exactly is that?
Sure. So simply put, it's the part of the hospital you go to for things like doctor's consultations, regular checkups, follow-up appointments, seeing specialists.
But you're not staying overnight.
Exactly. No hospital admission needed. You might also get some diagnostic tests done there, like blood work or maybe an X-ray as an outpatient.
Gotcha. So it's where a lot of day-to-day healthcare happens. But why can it sometimes feel so, I don't know, chaotic, like a busy train station?
Well, there are a few inherent factors. One big one is waiting times. They can be long, especially in popular hospitals or if you're seeing a very specific doctor.
Right.
Then you often have crowded waiting areas, lots of different people there for different reasons.
Mm.
Sometimes complex paperwork or just delays getting registered can add to the stress and, having to maybe go from one department to another for tests.
That can feel like you're running around.
It can. But just being aware that these are common challenges, that can actually help you feel a bit more prepared mentally.
That's a good point. Knowing what to expect helps. Forewarned is forearmed, like they say. Okay, so let's talk positive actions, the moodses. What can we actively do to make these visits less stressful? Where do we start?
Timing is a good place to start. Arriving early, but not excessively early.
Right, don't want to add to the crowd unnecessarily.
Exactly. Aiming for maybe 15 to 30 minutes before your actual appointment time. That usually gives you enough breathing room for registration, any paperwork, without feeling rushed.
And a buffer for traffic or parking issues, too?
Precisely. It just smooths out that initial part.
Makes sense. Rushing in is never a good start. Okay, what else is on the must-do list?
Being ready with your documents. This is really important. Get everything together beforehand.
Like what specifically?
Your ID proof. So for listeners in India, that might be your Aadhaar card, maybe your PAN card. Your health insurance details, definitely. Any previous medical records that are relevant.
Especially recent test results.
Yes. Hugely helpful for the doctor. Having those ready means they don't have to chase things down. Saves time, helps them get the full picture. Bodies like JCI really emphasize having past records available for continuity of care. It makes a difference.
So it's not just about making it quicker. It actually helps the doctor provide better care. How should we keep all that stuff organized?
Easiest way is probably a dedicated file or folder. Just keep everything together. Some people like using secure health locker apps on their phones too, which is great if you're comfortable with digital.
Okay. So we're there a bit early, documents in hand. What's next when we get to the desk?
Be clear about why you're there, right at registration. Is it a routine checkup, a follow-up, a new problem?
Does it matter if it's a specialist?
Yeah, mention that too. If you're seeing a specific specialist, say so. Sometimes the process or the waiting area might be slightly different. Clarity helps them direct you properly.
Okay, simple enough. Now, here's something I think many of us could probably improve on.
Preparing questions.
Yes. Thinking ahead about what you want to ask.
It's so easy to forget things once you're actually in the consultation room, isn't it?
Totally. You get flustered or just, time feels short.
So before you go, just jot down your symptoms. Any specific questions, worries you have, even on your phone is fine. Having that list keeps you focused, helps you maximize that valuable time with the doctor.
Good advice. It's your chance to get answers. Now, what about checking on the doctor's schedule? Like, are they running on time? Is that okay to do?
Absolutely. If it's possible, it's a good idea. You could try calling the OPD ahead of time just to confirm the schedule or see if there are major delays.
And some hospitals have apps now, right?
Yes, exactly. Many hospitals offer apps or patient portals or even just website updates where you can track availability or get estimated wait times. If your hospital has that, definitely use it. It can save you some anxiety.
Smart. Using tech to our advantage. Okay, last do for now. How do we just keep it together, stay calm in what can be a busy place?
Right. It's about cultivating a sense of calm and um, managing expectations. OPDs are busy. Waiting times will vary. It's just the nature of it.
So don't expect to walk right in necessarily.
Pretty much. So bring something to do, a book, some work, a podcast, whatever.
Yeah.
Helps you pass the time comfortably. Managing expectations and being prepared for a wait can honestly take a lot of the stress out of it.
Really good tips there. Okay, let's flip it. What about the don'ts? Things to actively avoid doing. I'm guessing being late is top of the list.
You guessed it. Punctuality really matters. Arriving late is a big don't. It can mean you miss your slot entirely, or you end up waiting much, much longer because the schedule's tight.
Right, throws everything off. What's another potential pitfall?
Trying to bypass the hospital's procedures. Every place has its own way of doing registration, check-in, how you move between areas.
So don't try to jump the queue or ignore signs.
Exactly. Follow the instructions from staff. Organizations like NABH have guidelines for patient flow for a reason. It's about safety and efficiency, not just rules for rules' sake. You might need to wait in a specific zone for a particular doctor, for instance. Respecting that helps the whole system work.
Makes sense. It's a system designed, hopefully, to help everyone. What about when the consultation is finishing up? What shouldn't we do then?
This is crucial. Don't leave without being absolutely clear on the next steps.
What do you mean?
Ask, do you need a follow-up? When? Are there more tests? Where do you go for those? Any changes to your medicine? Don't just nod and walk out if you're unsure.
And book things before you leave?
Yes, if you need further tests or a follow-up appointment, try to get that scheduled right then and there before you leave the hospital. It avoids potential delays or forgetting later on.
That's a really practical point. Avoid that, oh no, I forgot to book the scan, feeling later. Okay, another don't I think many people experience.
Feeling overwhelmed by information, especially if you need to go to, say, radiology, then the lab.
Yeah, juggling different instructions and locations.
Don't try to do it all in your head at once. Focus on one task at a time, get the consultation done, then figure out the next step. If you're lost or unsure where to go, just ask staff. That's what they're there for. Don't hesitate.
Good reminder, one step at a time. And finally, just interacting with others.
Be considerate. Simple as that. Remember, everyone in that waiting room is there for healthcare, possibly feeling anxious or unwell. A little patience and respect go a long way to making the environment less stressful for everybody.
Absolutely. Okay, we've covered do's and don'ts. What about proactive things, stuff we can do to actively smooth things out?
Well, we touched on technology earlier, but it's worth emphasizing. Use those hospital apps or patient portals if they exist.
For booking, checking times?
Exactly. Booking online, tracking waits, sometimes even accessing your records or getting reminders. Check the hospital website, too. They often have specific OPD instructions. It puts more control in your hands.
Definitely. What about while we're actually there waiting?
If you've been waiting quite a while, it's perfectly okay to politely ask a nurse or a receptionist for an estimated wait time.
Just to get a sense of things.
Yeah. It helps you manage your time and expectations. They might not know exactly, but often they can give you a rough idea.
Good to know it's okay to ask. And for those potentially longer waits.
Think about your comfort, especially if you know it might be a long visit. Bring a water bottle, maybe a small healthy snack. Staying hydrated and keeping your energy up makes a difference.
Simple but effective. Now let's zoom in a bit on the situation in India. You mentioned earlier that the sheer volume can be a factor.
It really can. OPDs in large Indian hospitals can be particularly chaotic just due to the high number of patients.
So that tip about pre-booking becomes even more vital.
Absolutely crucial. Calling ahead, using WhatsApp if the hospital offers it, booking via their website or app, doing anything to pre-book can save you potentially very long waits just to get registered.
Okay, pre-booking is key. What else should listeners in India be prepared for when they arrive?
Be aware of appointment and token systems. They're very common.
How do those usually work?
You'll typically register, then get a token number or queue number. You need to watch the display screens or listen for announcements to know when it's your turn.
So pay attention to the system.
Definitely. And navigating the hospital itself, finding the right department, the right waiting area, can be tricky. Don't be afraid to ask security guards or reception staff for directions. Look for signs, maybe color-coded lines on the floor, digital displays. Some hospitals might even have maps available.
It sounds like it can be a multi-step process, even before the consultation.
It often is.
Yeah.
You might have registration, then token collection, then waiting for your number, then the consultation, and maybe after that billing or the pharmacy. The key is to just take it step by step, stay calm, and ask if you're unsure. Each hospital might have a slightly different flow.
Okay. And during the actual consultation with the doctor in India, any specific advice?
Take notes. Seriously. Write everything down.
Like what?
The diagnosis, the treatment plan, medication details, dosage, timing instructions for any tests, and definitely the date for your next follow-up. A small notebook or just the Notes app on your phone is perfect.
Prevents forgetting details later.
Exactly.
Yeah.
Also, specifically ask about test results. Will they be online? Do you need to come back and collect them? Where from? Get that clarified.
Good point. Avoids a wasted trip. What about after the appointment is all done?
Make sure you collect everything, all your receipts, any reports you're given, the prescription. And again, if you need a follow-up, schedule it right there before you leave, if possible.
Saves hassle later.
Absolutely. And one more thing, consider giving feedback. If there's a help desk or an online form, sharing your experience can actually help the hospital improve things for everyone.
That's a great point, contributing to making it better. Any specific tips for family members or attendants who might come along in India?
Yeah, ideally, just one attendant per patient helps manage the crowding. Their role is really supportive, helping the patient stay calm, carrying the essentials, maybe clarifying things politely with staff if needed.
So they're part of the team.
They are. And a couple more quick India-specific tips. Try for weekdays and mid-mornings for appointments if you can, generally less crowded. Keep screenshots of your appointment confirmation or receipts on your phone. Use hospital portals for reports or e-consults if available. And basic courtesy, wear a mask if you have a cough or cold.
Really useful, practical advice there. Okay, let's shift focus slightly to something that affects a lot of people. Anxiety about hospital visits in general.
Yeah, it's very common. Hospitals can be intimidating places.
So what can help manage that anxiety?
Familiarity can help. If possible, maybe look at the hospital layout online beforehand. Use signs when you get there, floor plans if they have them. Just getting a sense of the space can reduce that feeling of being overwhelmed.
So demystifying the environment a bit.
Exactly.
Yeah.
And understanding the process, like we've been discussing. Knowing about appointment systems, preparing for waits with something to do, that predictability can lower anxiety.
What about during the visit, if you start feeling anxious?
That's where relaxation techniques can come in. Simple things like deep breathing exercises, maybe some mindful meditation or visualization, even just for a few moments in the waiting room.
Grounding yourself.
Yes, and staying connected. Maybe text or call a supportive friend or family member while you wait. Don't forget about resources the hospital itself might offer.
Like what?
Some have patient support groups, chaplains, social workers, sometimes even therapy dogs. See what's available.
Good to know those might be options. What about interacting with the doctors and nurses?
Communication is huge here, too. Being open helps. Ask your questions. Express your concerns. If you don't understand something, say so. Feeling heard can reduce anxiety.
And maybe limit doom scrolling about health stuff beforehand.
Definitely.
Yeah.
If checking news or social media about health makes you more anxious, take a break from it, especially around your appointment time.
What if the anxiety is really significant, like a real phobia?
Then seeking professional help is important. Talking to a therapist, a counselor, or even your main doctor about these fears. They can offer specific coping strategies.
Are there specific therapies?
Sometimes things like gradual exposure therapy can help, where you slowly get more comfortable with the hospital environment, guided by a professional. But definitely discuss it with your healthcare provider first. And honestly, building trust with your care team, your doctors, your nurses, that relationship itself can be a powerful antidote to fear.
That's a really important point. Trust makes a huge difference. Okay, this has been incredibly helpful. As we wrap up this deep dive, let's do a quick recap of those key takeaways, the main do's.
Okay, the big do's. Arrive a bit early, but not too early. Be document-ready ID, insurance, records. Be clear about why you're there. Prepare your questions. Check the doctor's timing if you can. And try to stay calm. Manage expectations.
Got it. And the essential don'ts.
Don't arrive late. Don't ignore the hospital's procedures or try to bypass them. Critically, don't leave without understanding your next steps. Try not to get overloaded with info all at once. And be patient and considerate of others.
Excellent summary. It really feels like if you put these strategies into practice, that OPD visit doesn't have to be this huge source of stress.
Exactly. It can become much more manageable, less anxiety-inducing. It lets you focus on what matters your health.
It empowers you, really.
Precisely. You don't need to rush or panic. It's about planning a bit and participating actively in your own healthcare journey.
So, for everyone listening, maybe think about how you can apply one or two of these ideas next time you have an OPD visit. See if it makes a difference.
Yeah, and we'd love to hear your experiences too, or any other questions you might have about navigating healthcare.
Absolutely. Thanks so much for walking us through all this today. Really valuable insights.
My pleasure. Important topic.